Welcome to our journey through the incredible world of vasopressins. These medications are powerful players in the intricate symphony of our body's functions, helping us manage blood pressure and more. Today, we're diving deep into the world of vasopressins and their game-changing role in medicine. First, let us discuss what are vasopressins. Naturally, vasopressin, commonly known as antidiuretic hormone, is a non-peptide hormone synthesized in the hypothalamus and stored in the posterior pituitary gland. It plays a vital role in homeostasis, primarily by regulating water retention in the kidneys and maintaining blood pressure. Beyond its natural occurrence, vasopressin can also be synthesized for medical use. Additionally, similar compounds, known as vasopressin analogs, have been developed to extend its therapeutic applications in medicine. These analogs are designed to mimic or modify the actions of natural vasopressin for specific clinical purposes, such as treating diabetes insipidus, managing certain bleeding disorders, or controlling blood pressure in specific situations. Let's break down the types of vasopressin analogs, also known as non-peptide antidiuretic hormone medications. Firstly, we have Arginine Vasopressin, often abbreviated as AVP. While not an analog in itself, AVP is the natural form of vasopressin produced in the body. It plays a critical role in maintaining fluid balance, primarily by regulating water reabsorption in the kidneys. This regulation is essential for ensuring that our blood maintains an optimal water level. Additionally, AVP contributes to blood pressure regulation, helping to maintain hemodynamic stability. It achieves this through its vasoconstrictive properties, which can increase blood pressure in response to certain stimuli or conditions. While AVP is a key player in these physiological processes, its synthetic analogs have been developed to provide more targeted and controlled effects for therapeutic use in various medical situations. In clinical settings, AVP is used as a medication in the management of vasodilatory shock, including septic shock, where it helps to counteract the profound vasodilation that occurs in these conditions. It can effectively increase systemic vascular resistance and improve blood pressure when other medications, such as norepinephrine, might not be sufficient. Additionally, AVP can be administered in cases of cardiac arrest as part of advanced cardiac life support, known as ACLS. That is to improve coronary and cerebral perfusion pressures when standard treatments are ineffective. Now, let's talk about Desmopressin, an analog of vasopressin. Desmopressin is a synthetic derivative of natural vasopressin. It's an interesting pharmaceutical agent because, unlike its parent hormone, it primarily focuses on minimizing urine production while exerting a relatively minor effect on blood pressure. This selective action makes it particularly valuable in treating nocturnal enuresis, more commonly known as bedwetting, offering significant relief for many affected individuals. Additionally, desmopressin has a crucial role in managing certain types of bleeding disorders, such as hemophilia A and von Willebrand's disease. It works by increasing levels of specific clotting factors in the bloodstream, making it an essential medication for patients with these medical conditions. Furthermore, it is an essential medication for managing central diabetes insipidus, a condition characterized by excessive urine production due to a lack of natural vasopressin. This dual functionality of reducing urine output and enhancing clotting factor levels underlines desmopressin's importance in therapeutic medicine. Moving on, we have Terlipressin. Terlipressin is a synthetic vasopressin analog with specific therapeutic uses. In the realm of vasopressin-related treatments, Terlipressin could be considered the specialist called upon for distinct critical conditions. It is primarily administered for the treatment of esophageal variceal hemorrhage, where its vasoconstrictive capabilities are vital for reducing blood flow to the bleeding varices, thereby controlling hemorrhage. This action is particularly beneficial also for patients with liver cirrhosis, where variceal bleeding is a common complication. Moreover, terlipressin is crucial in the management of hepatorenal syndrome, a form of renal failure associated with severe liver disease, improving renal function through its effects on blood vessels. Then there's Felypressin, another synthetic analog of vasopressin. It is used mainly in dentistry, often as a vasoconstrictor in local anesthetic solutions. The inclusion of Felypressin in these solutions helps to constrict blood vessels in the vicinity of the dental work, which reduces blood flow and prolongs the duration of the anesthetic effect by slowing its absorption into the bloodstream. This localized vasoconstriction also helps to minimize bleeding in the surgical field, providing a clearer view for the dentist and reducing the risk of hemorrhage. Lastly, we have Selepressin. It is a selective vasopressin V1A receptor agonist and a novel synthetic analog of vasopressin. It has been investigated primarily for its potential therapeutic use in treating vasodilatory shock, including septic shock, where it aims to improve hemodynamic stability without causing the significant side effects associated with non-selective vasopressin agonists. By targeting the V1A receptor, Selepressin can induce vasoconstriction and enhance blood pressure more selectively, potentially reducing the risk of complications like ischemia or fluid overload that are sometimes observed with broader-acting vasopressors. Although still under investigation and not widely available as a commercial medication, early clinical trials suggest that Selepressin may offer benefits in critically ill patients by stabilizing blood pressure with fewer adverse effects, thereby improving outcomes in shock states where conventional vasopressin and its analogs are typically used. While vasopressin analogs are critical in managing a range of medical conditions, they come with a range of potential side effects that healthcare providers must vigilantly monitor. Common adverse effects include water retention, which can lead to hyponatremia, a condition characterized by low sodium levels in the blood. This risk necessitates careful management of fluid intake during treatment. Cardiovascular responses, such as increased blood pressure and potential chest pain, also warrant close observation, particularly in patients with cardiovascular disease. Gastrointestinal side effects, including nausea, abdominal cramps, and vomiting, are frequently reported by patients. Some may experience headaches, ranging from mild to severe in intensity. Allergic reactions, though rare, can occur and be serious, requiring immediate medical attention. As we explore the nature of vasopressin analogs medications, it is important to consider their contraindications and potential for medication interactions. Within the delicate framework of health management, these medications are contraindicated in conditions such as chronic nephritis, where their propensity to promote fluid retention could exacerbate the condition, and in coronary artery disease, where the risk posed by their vasoconstrictive effects must be carefully weighed. Concomitant use with diuretics and corticosteroids necessitates cautious management due to possible interactive effects that could alter the efficacy and safety of treatment. In administering vasopressin analogs medications, medical professionals engage in close monitoring. Nurses play an essential role in this process, closely watching patients for changes in blood electrolytes and pressure, hallmarks of vasopressin's potent effects. They vigilantly adjust dosages with precision based on these parameters and clinical response to ensure efficacy and safety. Their careful supervision includes monitoring for signs of water retention, such as edema, and symptoms of hyponatremia, such as confusion or seizures. By keeping a watchful eye on heart rate, urine output, and signs of vascular constriction, nurses help mitigate risks, optimizing the therapeutic balance so that the benefits of vasopressin analogs medications substantially outweigh the potential side effects. Vasopressin and its various analogs, such as Desmopressin, Felypressin, and Terlipressin, are more than mere medications. They are essential lifelines that provide hope and facilitate healing for a wide range of conditions. Their utility spans from the acute urgency of emergency rooms to the routine management of chronic illnesses, making them indispensable in the medical field. These compounds are valued not only for their efficacy, but also for their versatility in treating conditions that range from diabetes insipidus and bedwetting to life-threatening bleeding and shock. As critical components of modern therapeutics, vasopressin analogs represent a cornerstone of innovative medical treatments. That's a wrap on our deep dive into vasopressins. As we continue to explore the world of pharmacology, remember that each medication offers its own unique way of saving people's lives. Stay tuned for more enlightening journeys into the world of medicine, and thank you for joining this educational adventure. This video was made for educational purposes, and no medical advice should be taken from it. For more detailed information, check out our sources in the description. Peace.